Hello and welcome to Pace Hospital's podcast. Today, we are discussing a critical and potential life-threatening condition that often goes under the radar, that is, pulmonary thromboembolism. Joining us today, Dr. Lakshmi Kumar, Senior Interventional Radiologist and Abdominal Imaging Specialist, having wide expertise in treating and managing pulmonary thromboembolism. In today's episode, he would like to explore what pulmonary thromboembolism is, its symptoms, risk factors, and the latest advancements in its treatments and prevention. Dr. Lakshmi Kumar, thank you for joining us at Pace Hospital's Hitech City.
Thank you for inviting me. Today I'll be sharing valuable insights into pulmonary thromboembolism, including how it develops, the warning signs to look out for, and the latest advancements in treatment and prevention.
Dr. Lakshmi Kumar, thank you for joining us. Let's understand exactly what is pulmonary thromboembolism.
This condition has three words: pulmonary, thrombus, and embolus. Pulmonary means lungs. Thrombus means a blood clot. Embolus means blocking a blood vessel, that is artery. So, if a blood clot blocks the lung arteries, then that is called pulmonary thromboembolism.
Can you describe the factors that contribute to pulmonary thromboembolism?
So the primary cause is usually deep vein thrombosis in the legs. So deep veins are the veins which are situated deeper to the skin in the lower limbs. If there is a blood clot formed there is a chance that this blood clot may break from there and it travels through the lower limb veins and then through the right heart, and then it reaches the lung arteries, and in the lung arteries it blocks the lung arteries, leading to pulmonary thromboembolism.
What are the common risk factors that predispose individuals to pulmonary thromboembolism?
The usual cause is deep vein thrombosis. So all the risk factors for deep vein thrombosis are risk factors for pulmonary thromboembolism. So the risk factors are habits like smoking, diseases like cancer or kidney diseases, or if you have any major surgery, like you had a surgery for lower limbs like bone fractures in pelvis or your femur tibia, and you undergone some surgery and you are taking bed rest for prolonged time, then there is a chance for blood to clot in the lower limb veins. Other risk factors like if you are traveling for a prolonged periods without moving your legs, like more than 6 hours you are traveling, either air travel or by road travel, then there is a chance that your blood in your lower limb veins can clot and it may migrate to your lung arteries. So other risk factors are using certain medicines like hormonal replacement therapy, oral contraceptive pills, and cancer medicines, chemotherapy medicines. So these are all risk factors, and some hereditary conditions also predispose to increased cancer risk, like if you have a deficiency of antithrombin or protein C or S deficiency, or if you have factor V lead-in mutation, and other conditions like antiphospholipid antibody syndrome. So these are all the risk factors. And recently we had coronavirus pandemic. So coronavirus is also a risk factor for increase in the formation of clots in your leg veins. So that is also can predispose to pulmonary thromboembolism.
What are the common symptoms of pulmonary thromboembolism?
So if you develop pulmonary thromboembolism, what happens? Blood clot blocks the lung arteries. So if you know your basic science from your school days, so we need oxygen for our survival. So our oxygen, whatever we inhale, this goes into our circulation. So from where it goes is through the lung blood vessels. So normally arteries carry blood rich in oxygen, and veins carry blood which is less in oxygen. So the blood which is rich in oxygen is called oxygenated blood, and the blood which is less in oxygen is called the deoxygenated blood. So normally all the arteries in the body, they carry oxygenated blood that is rich in the oxygen. So they carry this oxygenated blood from the heart to the other organs like kidney and liver and intestines, all the limbs, brain. Even the heart gets its blood supply, oxygenated blood from the arteries. Those arteries are called coronary arteries. And what the veins does is, after the organs utilize the oxygen in this blood, they will return this deoxygenated blood through the veins to the heart again. So from the heart, through the left heart, you get the oxygenated blood to the rest of the body, and this deoxygenated blood goes through the veins into the right heart. So right heart receives the deoxygenated blood and left heart pumps out the oxygenated blood. So after the right heart receives this deoxygenated blood, this deoxygenated blood is pumped into lungs through pulmonary arteries. So the pulmonary arteries are the only arteries in the body which carry the deoxygenated blood. All others carry oxygenated blood. So these pulmonary arteries which are carrying this deoxygenated blood, they receive the oxygen from the airway, from the air that we have breathed in. So this mixes with the blood and it becomes again oxygenated blood. This oxygenated blood goes into the pulmonary veins, and these veins will drain into the left heart. So the pulmonary veins are the only veins in our body which carry the oxygenated blood. All others carry the deoxygenated blood. So this oxygenated blood which is received by the left heart from the pulmonary veins, this goes into the rest of our body. So that is the importance of our lung circulation. So what is the lung circulation? It receives oxygen from the air and it gives the oxygen to the blood, and this blood goes into the rest of our body. So if there is a block in the lung circulation, the lung arteries, if they are getting blocked, so the oxygen supply to the body decreases. So all the organs can get affected due to decrease in the oxygen levels in your blood. Even the heart can get affected due to low oxygen, so its function will decrease, and the kidneys can get affected. So the related symptoms will develop, like you will develop chest pain. Breathlessness means you will be longing for air. You are not able to get adequate oxygen inside, so you will be breathing rapidly, and your saturations will be less. Chest pain will develop, and you will feel lightheadedness, syncope, because your brain is not getting the enough oxygen supply. And commonly this is due to a deep vein thrombosis. So your leg may have swelling, pain, redness, increased local rise of temperature, and also your heart rate can increase.
What specific tests are used to diagnose pulmonary thromboembolism?
So if you have any of these symptoms, you must urgently consult one nearby doctor. So what does the doctor do is, he will first take your history, and history means what are your symptoms? Are you feeling any breathlessness, any chest pain, and any lightheadedness? And he will do physical exam to see what is your saturation level in your blood, and what is the heart rate, what is the blood pressure, and he will examine your lower limbs. Is there any swelling, tenderness? So if there are all the features present, then you have a high likelihood that you have pulmonary thromboembolism. So now, to confirm whether you have pulmonary thromboembolism or not, he will order some tests. So to look at the pulmonary arteries, we have one beautiful study called CT pulmonary angiography. So in that study, we will inject one contrast or dye into your peripheral veins, means the veins located in your hands or legs. From there, this contrast will go into your heart and it will go into your lung arteries. So after injecting this dye, we will do the CT. So this dye increases the contrast of your pulmonary arteries. So if there is any block within this pulmonary arteries, we can clearly see whether there is any block or not. So this is nowadays the standard of diagnosing the pulmonary thromboembolism. If you have any contraindication for this study, like you have allergy to the contrast, then we may go for other nuclear medicine based study called ventilation perfusion scan, in which a radioactive dye is inhaled and also a radioactive dye is injected into your peripheral veins. So that dye can be examined in a special scanner. So that will tell us what is the level of circulation in your lungs. Is there any defect in some part of circulation, and is there any defect in the ventilation of some part of lung? So that is also one more examination to diagnose the pulmonary thromboembolism. So next thing is to know the cause, where it is coming from, the clot, where it is coming from, we may order the color Doppler study of lower limb veins. So by this study, we can see is there any clot in your lower leg veins, or sometimes you can develop clot in your upper limb veins also. Like in chronic intravenous drug abusers, they will inject drugs repeatedly into their upper limb veins. Those can get blocked, and that clot can migrate to the lungs. So that also we can diagnose. And moreover, in these IV drug abusers, these clots are most of the times infected clots. So that infected clot will go to lung, and it will cause infection in the lung also. That condition is called septic pulmonary embolism. So all these clots in your limbs can be diagnosed with your ultrasound color Doppler. Other test, blood test is a D-dimer test. It can recognize if there is any clot anywhere in your body venous system. So that is knowing the cause. And to know the risk factor, we may do certain tests. If you have an obvious risk factor like prolonged immobilization or long distance travel, then there is no need to test for the cause. If you don't have a specific reason, obvious reason, then we may need to do additional tests to diagnose the cause of this blood clotting in your veins. So this may include genetic tests, so to detect any genetic abnormality that predisposes to blood clot formation in your veins, or certain scans or tumor marker tests to detect any cancer, any dormant cancer, underlying cancer in your body. So, and any kidney disease which can predispose to these clots. So these are all the tests you may undergo while you are evaluated for the pulmonary thromboembolism.
What are the treatment options for pulmonary thromboembolism?
So the main goal of pulmonary thromboembolism treatment is to decrease your symptoms, to open those clots. And so the main goal of the treatment is not to make the clots bigger than those are at present. So these can be achieved most of the times with the medicines. So mostly the medicines which we use are the anticoagulants. That means they prevent the blood from clotting again. So those are the primary medicines that we use. If you have more symptoms, that means submassive or massive embolism, which means your BP is very low, less than 90, or it is less than 40 mmHg from the previous normal BP range, or if your heart rate is very high and you are old age and chronic lung disease or chronic heart disease, in those cases we may require to give you thrombolytics in addition to the anticoagulants. So what does a thrombolytic does is, so it breaks the clot that is formed. So the anticoagulant, it prevents a formation of a new clot, whereas the thrombolytic breaks the clot that is already formed. So, but it has some inherent risk, this thrombolytics, like increased predisposition to bleeding from other organs like brain or abdomen or anywhere in the body. So that's why we assess the risk benefit ratio. If there is more benefit for the thrombolytics compared to the risk, then only we will advise this thrombolytic. So in patients with more severe condition, more severe pulmonary embolism, who have more bleeding risk, with thrombolysis from peripheral veins, that is veins in the lower legs or forearms, then we may give this thrombolytic directly at the level of pulmonary arteries. This can be done by an interventional radiologist. So the interventional radiologist role is to break a clot if it is a severe pulmonary embolism and the patient is not a candidate for systemic, that is IV thrombolysis from a peripheral vein, then we go up to the pulmonary arteries, then we inject the thrombolytic there, or without using thrombolytic we may suction the clot, or we may break with the clot with our special devices, so that your block in the pulmonary arteries will decrease and circulation to the lungs will be restored again. So we do this with the help of local anesthesia. There is no need of general anesthesia. So with local anesthesia, under ultrasound and our X-ray guidance, we put a small needle in your lower limb vein, and through that needle we put a small catheter, that's a long narrow pipe, and this pipe we will take it through to your lung arteries under X-ray guidance, and there once we reach the level of block, we may inject the thrombolytic, or with the help of catheter we will suck out the thrombus, or with our special catheters we can break the clot, and thereby we can restore the circulation back to normal in the lungs. So this is the role of an interventional radiologist in the treatment of pulmonary thromboembolism. So other treatment which is offered is surgical embolectomy. Means if the patient's symptoms are severe and there is no available treatment from interventional radiologist, means the interventional radiologist is not available and good surgical team is available, then you may go for open surgery. They can cut open your chest and open your pulmonary artery, and then they can remove the clot and then suture the artery and the chest wall again. So this is the other treatment that is available.
What are the preventive measures for pulmonary thromboembolism?
The pulmonary thromboembolism can be prevented by preventing deep vein thrombosis in your legs. So whenever you go for a long journey like car travel or flight travel or a bus by road travel, it is advisable to take a walk every 30 minutes or so, or if you are not able to take a walk, you can at least flex and extend your feet like this, flex and extend your feet, and flex and extend your knees. So this is also a very good option to prevent formation of clots in your body. So next is if you are a patient who underwent surgery for your fractures, so in those cases we give some low dose anticoagulant to prevent formation of blood clot in your veins. Also in these cancer patients and other high risk patients, we give this low dose anticoagulants to prevent formation of clots in your legs. So what are the special precautions that a patient on anticoagulants need to take? So a patient on anticoagulants is more prone for bleeding even with a minor injury. So because these anticoagulants, they will prevent formation of a blood clot in your blood's circulation. So even with a minor injury, the bleeding may not stop. So that's why you need to be careful with your day-to-day activities. Better wear as much as protective gear as possible, like wearing helmets and wearing arm pads and leg pads while you are riding, or if you play any sports, and using soft bristled toothbrush, and avoiding foot injuries by wearing shoes all the time. So these are all the special precautions that you need to take if you are on anticoagulants. And if you by chance develop any injury and bleeding, and it is better to stop the anticoagulation dose after consulting with your physician, and immediately you need to consult the nearby doctor and take the necessary advice.
Can pulmonary thromboembolism cause sudden death?
Yes, it can lead to sudden death. If there is a massive clot in your lung arteries, it may block multiple lung arteries. This can lead to a sudden decrease in oxygen supply to the rest of your body and increase in workload for your right heart. So, if the right heart workload is more, it will get dilated. This may compress the left heart also. So, this can lead to decrease in outflow from the left heart also. This will lead to decrease in blood pressure, and decrease in oxygen supply and decrease in blood pressure can lead to sudden death if the thromboembolism and the clot burden is very massive or severe.
So, doctor, is it possible for pulmonary thromboembolism to go away by itself?
If the clot burden is very less, then you may not develop any symptoms. Then it will be treated on its own. The body has inherent mechanism to lyse the clots, to break the clots, so it can decrease. And if you have a significant clot burden and you are developing symptoms, you may require at least anticoagulants medicines for the treatment.
Is there a direct link between high cholesterol levels and the risk of developing pulmonary thromboembolism?
We have two types of cholesterol, LDL and HDL cholesterol. If the LDL cholesterol levels are more, it predisposes to increased clot formation in your arteries. It has no or less relation with the veins. Whereas if the HDL or the good cholesterol levels are low, it may predispose to increased clot formation in your veins. So low HDL cholesterol can lead to venous clots formation and thromboembolism.
Can uterine fibroids cause pulmonary thromboembolism?
Yes, large uterine fibroids can compress the veins which are present in your pelvis. So if these veins are compressed, the blood flow in these veins will be decreased and clots can form there, and those clots can go up to your lung arteries and can cause pulmonary thromboembolism.
So, doctor, are there any specific conditions or factors associated with pulmonary thromboembolism that could indirectly affect stroke risk?
Although pulmonary thromboembolism cannot directly lead to brain stroke in most of the cases, a patient with pulmonary thromboembolism, that means a venous clot, it has also risk factor to develop an arterial clots. For example, if a cancer patient has a venous clot, he also has a tendency to develop arterial clot. So if there is an arterial clot in the brain arteries, that can lead to brain stroke. So both conditions can coexist. Brain stroke and pulmonary thromboembolism can coexist in a patient.
Can you get pulmonary thromboembolism while on blood thinners?
Although you are taking blood thinner, you can get venous clot in your legs and it can lead to pulmonary thromboembolism. How means if you are taking the dose of blood thinner less than that is prescribed, that is number one risk factor that you can get clot in your veins. So second risk factor is if you have a underlying disease, very severe disease like cancer, although you are on blood thinner, you may get clots. Although you are on blood thinner, you may get clots and that can lead to pulmonary thromboembolism.
Thank you, Dr. Lakshmi Kumar, for sharing crucial information regarding the pulmonary thromboembolisms to our listeners.
I hope this information can be valuable for the listeners, and it's crucial for everyone to understand this condition, as awareness can lead to early detection and potentially save lives.
If any of you have any further questions regarding pulmonary thromboembolism, please don't hesitate to consult an interventional radiologist. And remember, early intervention is crucial. So be aware of the symptoms and seek medical help if needed. We will be back with another episode on Pace Hospital's podcast. Until then, stay safe and take care. Thank you.